It is Sunday, May 31st, one day away from the reopening of business here in Kahnawake. Welcome to the COVID-19 Task Force Daily Update. As we get prepared for tomorrow, we have a fairly substantial program today. Lisa Westaway from the Cattery Memorial Hospital Center will be here, as well as the Commissioner of Public Safety, Lloyd Phillips. But before we do that, we are going to introduce you to a gentleman that is familiar to just about everybody in Kahnawake. If you don't know his name, you've seen his picture as you drive by the Peacekeeper station. He is Constable Forrest Horn, joining us on the program. And it's good to have you here, Forrest. How are you doing?
I'm doing great today. Thank you.
Yeah, let's talk about first of all your experiences here in the last few weeks during the COVID-19 crisis here, the pandemic. You've been a busy guy. I don't think you've taken too many vacation days. Tell us a little bit about your experience in these last few weeks.
Last few weeks, maybe even the last few months, it's been pretty chaotic from my point of view, being on the road all the time, and when I'm here at work, a number of the calls that we do respond to have overtaken the more serious calls concerning the social distancing that the directives have been put in place for the COVID-19 pandemic here in the community. It has overtaken a majority of our normal calls, I would say 100-fold.
Is that good or bad?
In a sense, it's different. I say different because of the precautions that we have to take now and the procedures that we have to now follow concerning the safety of ourselves, including the clients that we are dealing with.
I know we're going to talk a bit about some of the equipment and some of the procedures a little bit later on. Let's talk about the experience you've had with community members. We've talked about this before. We've had other people on. In your experience, what's it been like for the people you've been dealing with? Have people been okay? Have they remained patient? As a police officer, you sometimes see a different side of people.
Well, my experience working since this pandemic started, there's been a lot of patience from the community members that I've experienced. They are aware of the community, and they were aware of everything that was put in place by the task force, and they have been doing a very, very good job. Especially when the warm weather came around there a couple weeks ago, we were responding to a lot of calls where people thought that community members were not social distancing. So we did respond to the calls, and when we did get on scene, people were maintaining the 6 feet or 2 meters away from each other. You know, they were still in a social gathering, but they weren't in close proximity of each other.
Mm-hmm. It may be a little different, of course, with the non-native people, because I know you've been busy over the past few weeks with people looking to stop at cigarette stores, most notably, but other businesses as well. What's it been like dealing with the public who are not from Kahnawake?
When we deal with the public, not a community member from Kahnawake, they do understand what is going on, but they were claiming that they weren't aware that the community had prohibited access. So in my dealings with them, I would explain the directive that was in place and advise them that they are in contravention. So because they're in contravention and it's for a public safety for the community, had to do what we had to do and issue the citations and safely escort them off the territory, as well as give them a warning that if they do return, that they may have further repercussions.
Mm-hmm. And I understand, I know that it's been pretty well publicized that tomorrow, June 1st, is the reopening of business, but you were actually on the road earlier today. Are you still getting people who are not aware or pretending to be not aware, and are you still having to deal with that?
Yes, we've actually responded to more than 20 calls of non-community members being in the community, looking for cigarettes, stopping at stores, looking in the windows. The community is being very vigilant and letting us know where these individuals are. So the team that's on now, my team, We would respond effectively, try to locate the individuals. And because it's one more day away from the actual opening, we've been a little bit lenient today because it was a kind of a busy day. So we just kind of letting them know that community is not open yet. You can't be here, so you have to leave the territory immediately, or you will face a monetary ticket.
It's only one more day, for God's sake. So, well, that all happens tomorrow. Let's talk about some of the precautions that the peacekeepers have taken. I know you brought some equipment now that you're using these days, and maybe talk about some of the new procedures that you're doing.
So when we deal with the public, I try to maintain my distance, a minimum of 6 feet. When I'm dealing with an individual that has come onto the territory and I have to identify them, I took it upon myself not to take the documents from them, rather to photograph the documents, so this way there's no contact between me and the individual that is on the community. When I know I have to come in contact with somebody, I have a large array of personal protective equipment that was issued to me by the department, which includes safety gloves, vinyl, rubber, nitrile. I have the 3 different types. We were issued a P95 mask. We were also issued a surgical mask, and just recently we were issued a full face visor that we put on if we have to deal with somebody that may have come in contact with a COVID-19 patient. So it's really comfortable. It kind of gets in the way a little bit, but we certainly adapt to it.
All right. I noticed you have I don't know if we got a good view of all of the things there. You have sort of a set of the different gloves and stuff like that. Does it affect your ability to work at all?
It does. It's taken some time to adapt to a system where I can effectively put on my protective equipment before I respond to a call where I know I may have to come in contact with an individual. It ranges anywhere from an additional 20 to 30 seconds to get the gloves on, to get the face mask on, and make sure that I do put on some alcohol solution on the exterior of the gloves, so this way that the gloves are clean and disinfected before I have to come in contact with anybody that I'm dealing with.
Mm-hmm. So I guess with that, you're pretty ready then for whatever changes come our way tomorrow with a little bit extra traffic in the community?
Yeah, I'm pretty sure we're all going to be prepared, myself included. We've been dealing with this for the last couple of months, and we kind of have our procedures down pat as how we're going to deal with individuals, including the non-community members that will be frequenting our territory starting tomorrow.
All right. One last question, Forrest, and just maybe more on a more personal note. You've been, you and your fellow officers and people on the front lines have had such a long stretch now of being in the pandemic. How are you holding up?
Well, trying to keep my family safe, trying to keep myself safe, because after I'm dealing with the public openly, I do have to go back home. And the procedures that they have put in place here at the department, at the Peacekeepers, concerning, cleaning the uniforms, showers readily available prior to leaving to go home, and disinfecting from my patrol vehicle to my personal vehicle, the doorknobs, going inside, washing my hands, taking, changing out my clothes, and this way so that I can interact with my family. Because that's one thing that that was my biggest fear, was getting somebody from my family sick from me being out there on the front line. So I've taken all the necessary precautions. It was a little stressful at the beginning, but now I've getting into my routine, and it's going to be the norm for the next little while anyways.
Yep, that's for sure. Well, I think we appreciate it, the community appreciates it, and your family appreciates the work that you're doing, and and taking care of them as well. Forrest, thank you very much.
Thank you for having me.
All right, Forrest Horn of the Kahnawake Peacekeepers, Constable, and he is actually just finishing his shift here on this Sunday afternoon. Now, as we move along on the program, we are joined by Lisa Westaway, who is the Executive Director at the Cattery Memorial Hospital Center.
Thank you. Good afternoon. So we wanted to talk a little bit today about the decision to reopen business tomorrow. In fact, we see constant, we hear, we see, we participate in constant debate over the dilemma of when to open the economy, when to reopen. Is this the right time? When is the right time? How do we make this decision? So we've spoken a little bit about this over the last little while. We've spoken about the World Health Organization strategy to transitioning to and maintaining low levels of transmission or no transmission if possible. So I'm going to repeat those, but then I want to talk a little bit about other areas that we've looked at that have allowed us to make this decision for tomorrow. So again, just to repeat, the World Health Organization's criteria, or in fact, it's not really criteria for opening, it's criteria that should be in place to ensure that you have a successful reopening. So it's a little bit different there. So I want to talk a bit about that, so that COVID-19 transmission is controlled. It is controlled in Kahnawake, and in fact, it's more and more controlled in the surrounding communities. Sufficient health and public health capacities are in place. So Lloyd will give more specifics later about all the elements that we've put in place here in Kahnawake that can demonstrate that there are sufficient health and public health capacities in place here in Kahnawake, mainly with our ability to test, contact trace. The outbreak risks and high vulnerability settings are minimized. Workplace preventative measures are established. We have risk of imported cases are managed, so this is the cross-border travel that we've spoken about. Communities are fully engaged, and that definitely is one of our strengths. And we've added, and this comes from Dr. Gauthier, really added in the creation of a culture of respect within the community, and this is something that always existed, but that we really want to enforce upon, so that we're comfortable. We're comfortable saying to our friends or family, "Hey, you're not wearing your mask properly," or "Did you think you're a bit too close together?" So the World Health Organization states that managing a controlled and deliberate transition from a scenario of community transmission to a sustained, steady state of low transmission is really the best case outcome for a community while awaiting for a vaccine. And we know that a safe and effective vaccine is still far away. We don't expect that anytime soon. And decisions about when and where to transition should be evidence-based, they should be data-driven, and they should really happen in phases so that you can control and monitor as you move forward. So it's really, really important, as per the World Health Organization and what we've seen from data from other countries, to really have real-time accurate data regarding testing of suspected cases, the nature and isolation status of all the confirmed cases, the number of contacts per case, and the ability to do contact tracing. This is something very different here in Kahnawake from everywhere else. So everywhere else has their regional public health team, but we've created a local public health team that's going to really take control of these elements in order for us to be able to have that real-time data. So despite having created this environment that meets the criteria that the World Health Organization states that we need, what else have we done, and what other criteria are we using in order to make our decision? So this is somewhat of an ethical decision that we have to make, because we are not able to fully know what the consequences might be. We can only use the data available to us right now in order to make our choice. And so if we look at, there are many different theories or models or frameworks that exist for making ethical decisions. And there are certain steps that I'll go through with you in order to make that type of a decision. So the first is to have a clear understanding of the problem, to identify and study the problem based on facts. So that's what I spoke about earlier from the World Health Organization, evidence-based data, real-time data, being able to look at the options that you have at your disposal, understanding the values of the community, of the people within the framework of the decision that you're making, and then evaluate your options and choose based on that data, based on facts, and be able to justify the decision that has been made. And following that decision, to be able to sustain it over time, to be able to monitor it and evaluate the impacts so that you can be flexible and modify as required. So it's not necessarily about a right or wrong, and part of the reason why we see such debate and division within the community is because of that fact. There is no right or wrong answer. We all are right, and we all have our opinions that are very justified. So if we look at this decision-making process, and the first step being understanding the problem, do we have a full understanding of the problem? Much of what we see in the debate is a debate between health and safety and economy or money. But can the two really be separate, or are they interrelated? So these are some things that we want to talk about today. So to be able to understand that and understand the problem a little bit better, what we want to look at are the social determinants of health. So the First Nations Health Authority actually has a model for social determinants of health. If you can imagine circles, one circle in the middle and a bunch of circles kind of encircling that middle circle. So the center circle is really us as individuals. It's human beings, and it represents our own responsibility for our health and wellness. The second circle is really the importance of 4 facets that are very important to Indigenous communities, and very much so here: mental, emotional, spiritual, and physical well-being. All 4 must be balanced for well-being. All 4 must be working together for wholeness, and must be nurtured together to create a holistic level of well-being. The third circle is respect, wisdom, responsibility, relationships. They're overarching values. And the fourth circle are really the people that surround us and the places from which we come, so our nations, families, community, and our land. And these are all critical components to health and well-being. Finally, the last circle depicts social, cultural, economic, and environmental determinants. They are overarching for our health and well-being. Why are we talking about this today? And it's really mostly to talk about balance and to talk about the fact that economy and health are very, very closely related, and one does not and cannot exist without the other. If we take just a couple of those social determinants of health, namely unemployment and social isolation, what are some of the impacts of that over the long term? So remember, we're not necessarily seeing impacts today of unemployment and social isolation. These are impacts that we're going to continue to feel over the next 5 years. So there are certain there is increased death related to suicide, related to drug overdose or alcohol-related death. There's death related to conjugal violence, or death or societal impact, lack of access to health care, unhealthy food choices, and poverty. So these are all impacts that we're going to see probably over the next 5 years. And the longer we stay closed, the more these impacts, these elements will impact us greatly over in the coming years and future generations. And of course, the balance is, how do we balance between those impacts and the death that is possible related to COVID-19. These are not easy decisions to make because we don't actually have numbers. We can't necessarily predict how the reopening might impact our number of cases or deaths here in Kahnawake. We can't impact how not opening necessarily will bring about deaths with respect to some of these elements that I just described, but we have to try to find a balance, as we spoke about in the determinants of health, between our spiritual, our mental, our physical well-being. So when elements of social determinants of health are out of balance, these are the impacts that we have to think about. If we look at a little bit of data, some data that we're able to pull for Kahnawake in particular since the pandemic started, we know that we've had 18 cases, 6 related to an outbreak that happened early in March. We know that we have 1 active case presently, and we know that we've had 0 hospitalizations and 0 death. We also know that there are 921 people who are receiving financial support through the Kahnawake the economic relief measures. We also know that by next week we will have spent over $5 million in economic support. Again, noting that this money will not exist forever, and the lack of those funds, the possible lack of funds in the future, could have drastic impacts on our community. We know that 18,900 hot meals have been delivered. That's an average of 300 per day. We've seen concerns by the peacekeepers of calls for conjugal violence, theft, assault, alcohol, and drug-related incidents. We've seen amplification of issues related to anxiety, depression, and family tensions. We've seen a 30% decrease in access to health care for many different reasons, not always because the health care is not available, but sometimes, yes, because it isn't available. We've also seen ambulance calls that were down 35% in April, down 15% in May. So these statistics demonstrate societal, social impacts to the community. The longer that we do not reopen economy, the longer that we will see these, all of these impacts being amplified greatly. So why have we chosen now to move forward? I'm just going to summarize that a little bit based on the information that I've just shared. Yes, we feel that in Kahnawake we have done a really excellent job of creating an environment that meets the criteria that the World Health Organization has stated is required in order to move forward. We feel that by opening now, we're minimizing the risks associated with the impacts of both COVID-related deaths and other related impacts, as we've spoken about from the measures and the determinants of health. We're trying to balance quality of life with the need to maintain these measures and changes that are being implemented for the next year to year and a half. We know that we're in this situation for a long time to come. We know that there will not be a vaccine next week. We can't hold off reopening of the economy until the vaccine exists. That would be way too long. We also want to allow autonomy and responsibility of individuals to make their choices and decisions based on the education that we will continue to provide. Is this decision without risk? Definitely not. We do not pretend that it's without risk. We have not stated that it's without risk. We do have risk moving forward. We have risk no matter what decision we make, and it's not a fun decision to make. It's not an easy one to make, but it's one that has to be done. How do we take control as individuals? How do we deal with the fear that this brings about in us? Lloyd is going to speak a little bit about some of these areas and what we've done in the community to try to mitigate the risk as we move forward. And I hope that will be helpful. Thank you.
Nyalko, Elisa, very well presented. And of course, Lloyd Phillips is here. He is the Commissioner of Public Safety here in Kahnawake, and he will give us his thoughts as we are less than 24 hours away from businesses reopening here in Kahnawake. Lloyd?
Thank you, Lisa, and thank you, Joe, for that. Yeah, certainly, it's a I guess a somewhat of a nervous time in the community, you know, and a lot of emotions out there, and we certainly understand that, and I certainly share those with you. But just to finish up on a few notes that Lisa was speaking about, because we felt, again, to add into some of the ways to minimize or mitigate any possible spread of the COVID virus, you know, there are a number of things that were put into place that goes far above the requirements that are out there from the World Health Organization, or more than any other place that we've seen, across Canada or in the U.S. for that matter. You know, and certainly one here is what we're instituting is an employee daily health check, where each person who has received a health inspection and each person who's opening is going to be requested to do a brief questionnaire every morning with their staff to ensure that if they do have any signs or symptoms of the COVID virus, that they are immediately sent home and asked to self-isolate. So we're hitting it right at the front line to ensure that if anybody has the virus or signs of the virus, that they leave their workplace immediately. So employee daily health checks is something that we think is very important, as well as infection prevention control measures to ensure that there is a education there, but also products available to ensure that you minimize the possibility of the spread of the virus, and any type of other measures that need to be taken to follow in line with that, such as proper PPE. But also the what's called the environmental adaptations. Basically, what we're talking about there is the workplace. As you have probably seen, there's different things in place, such as minimizing the amount of people in one location, in one store at a time, setting up plexiglasses around the cashier or in certain areas, or in businesses where people got to work in close proximity. There's plexiglass in between individuals. So that's something that is very important, and that's one of the key things that we have really been pushing hard with the people who are working, on getting their business ready for the opening. We also have, obviously, we said it many times over the past couple of weeks, we have a series of inspectors who've been very busy the past week going around the community, ensuring businesses are ready to open. And I'm glad to say they've been very busy. They've been working throughout the weekend, and many businesses are ready to open tomorrow morning as well. And those will be ongoing discussions and ongoing inspections over a period of the foreseeable future. Again, not necessarily I'm not talking about for an enforcement purpose. It's more just to go there to ensure that the measures are in place, remain, and maybe there may be additional information that they may have that we come across from a medical perspective that we may want to relay to the business owners or to employees. So we'll have our inspectors out there again on the front line doing what they can. As Lisa mentioned, we also have a public health team, which is very important to help with the identification of any cases, testing, and as well as doing contact tracing of who the person may have been in contact with. This is something that previously, over the months, is something that rests with the public health agency in Quebec. Public health, as we refer to it often. But this is something we're also looking at, doing something very local, so that we could quickly identify and track any possible cases that may come about in the community. So that's another very important measure that I think that we have put into place that I think is crucial. Again, piece of the puzzle moving forward. As well, there remains financial support through the Kahnawake economic relief measures for people who return back to work. There will be a period of transition there, But in the weeks and months to come, if somebody does develop the signs and symptoms of COVID virus, that they will have the opportunity of leaving the workplace and having that time to get well, to isolate and take care of themselves without the fear of not having dollars available for them to pay their bills, so they could go back on the KERM for the period that they require, to see that they're clear of the COVID virus. So that's like a backup plan. I think that is important for people to understand, because we don't want somebody to feel obligated, to go to work if they're not feeling well. They could possibly have the virus. It could just be a regular cold or flu. That's always a possibility. But if there's that risk at all, we want people to remove themselves from the workplace, as quickly as possible. And by having those means available to them, I think that makes it much more easy for them to do. Community mobilization, and that's basically what we've been trying to do for a while now, is ensuring that the whole community is aware of what's happening and why things are happening, and ensuring that the expectations on the business owners and such is not only known by the business people, but it's also known by the average community member. So if you happen to walk into an establishment, whether it be in Kahnawake or for that matter outside the community, and if you don't see that there's proper safety mechanisms in place, simply turn around and walk out. And also, if you see somebody who is not following proper safety standards, again, respectfully, but it's not hard to remind somebody, 6 feet distance, step away. We're all here again in this together so ensure, and community mobilization is very important. And as well as communications and education, which is going to be an ongoing process over from now until the foreseeable future. As new information comes available, we will continue educating the community on the latest information on the COVID virus. Any additional safety precautions that may be required, we'll be here to provide that information to you. Because as it was mentioned, this is an ongoing pandemic. It's an ongoing process. Yes, there is that calming of the waters, so to speak. But we have to make sure that we always obviously remain vigilant, and we have to maintain that in the back of our mind, or the front of our mind, I should say, that we are still in this pandemic mode. And by doing proper mitigation measures, we do have the ability to remain safe. We do have the ability to ensure that any increases in transmission are very minimal, and that they could be handled and dealt with quickly and effectively. So those are the things that are in control, I guess we have for our community, and I think it's important to underscore those issues, because we know there is a number of mixed feelings in the community. Like I said, when it first started, there are that anxiety. There is some fear in the community of what does this mean moving forward? Does that mean that we're at a higher risk? Does that mean that there's a possibility of people getting sick? That's always a possibility. And as Lisa mentioned, we're never going to get down to a point where we're going to say there'll be zero risk. That's going to be months and months, if not years down the road, until there's a vaccine where you can feel confident in saying that. But if you're in an area that you feel is where we're safe enough to move forward, weigh in all the facts, as Lisa clearly outlined, including mental health, economic aspects, and the risk of the COVID virus. And once we feel confident in that, with proper medical advice, we feel it is time and proper, to move forward. So, but I also spoke to a few, actually today, a matter of fact, a few business people and a couple of people who are going to be returning back to work. On the flip side, who are very excited. They're happy that they're having a sense of normalcy, even though things are not going to be the way they were back in March. But they do feel okay. They're happy. They want to get back to work. They want to get back into routine. They want to get out of their house. They want to be self-sustaining. Those sort of things. So there is that side as well. So obviously, I'm glad to hear that people are looking forward to the new normal, as we've been saying. But again, but we understand, and I certainly appreciate the fact that there is a level of fear in the community. So tomorrow is a big day. And when we decided to move forward with the June 1st date for opening, it certainly wasn't easy. As hard as it was for me to stand up here on March 17th, then again on the 18th and the 20th, informing businesses of all natures that you must close your doors, which was a very difficult decision and very hard to do. It was even more difficult for me to stand up here and speak to you to saying we are reopening, and this is how we're reopening, because we knew ahead of time that there will be concerns, there will be fear, there will be people saying that it's too soon, but there'll also be people who will be saying it's about time. So we had to look at it from an evidence-based position, and that's what we move forward with. So again, it certainly was not an easy thing to do. It was probably one of the more difficult decisions I ever had to make in my life, to be quite honest with you. No, because we say the saying, we're all in this together, and this is more true now than ever. Because even if you look at it, from a personal perspective, and I don't talk about myself very often, I said, but as all task force members know, we live this every day just as much as you do. And I got both parents who are staying at Cattery Memorial Hospital Center. Both parents. I haven't seen them, excuse me, in almost 3 months. I have my mother-in-law who had to start chemotherapy during the pandemic, who is now immunosuppressed and has to be self-isolated. I had to spend 6 weeks home alone because my wife had to go take care of my mother-in-law when she really needed a lot of assistance. So it is personal. It's personal to me just as much as it is to everybody else. But I'm up here every day trying to look at all the facts, look at everything that's out there, listen to what people are saying, good and bad, but then pull that all together and have to stand before you and deliver a message that is welcomed by some and not by others. But I'm confident in the decision that was made by the task force. I'm confident that we're on the right path. I am confident if we stick together as a community that we will have a successful reopening. And remember, this is only phase 1. There are other businesses who are substantial businesses in the community who are going to remain closed for the foreseeable future. The organizations are not going to be returning back to work the way they did until the green light is given for them as well. So there's still a lot of things that have to happen over a period of time until we get the community back to what is deemed to be looking at a new sense of normalcy. And one of the key things that we have to keep in mind is, the cornerstone of almost everything we're doing here is maybe the easiest thing to do, and that's physical distance, social distancing. We always maintain that 6 foot distance. We will be one step ahead of the game. But unfortunately, if you observe around the community and again, feedback from the peacekeepers who are around the community over the past couple of weeks, observing what's happening, and they've been intervening and talking to people, but it seems more and more people seem to be letting go of that physical distancing. So again, I ask the community to keep that in mind. You are in control of your immediate space, and you can do that, as best as you possibly can. And what I'll end off with saying is on a final note, is I know there was some information that was put out yesterday regarding some non-locals being allowed in the community for visitation. In the attempt to fix one problem, it's kind of created another issue. So what I'll just tell the community is that will be retabled back tomorrow with the COVID task force for more discussion. So with that, Kahnawake, what I want to do is just wish everybody luck out there. I know the people who are ready to return to work tomorrow. Good luck, be safe, and we'll be there with you. Kahnawake.
All right, thank you very, very much, Lloyd. And as we said in the past, those businesses that are closed and reopening, they've had some pretty good role models among those stores and businesses that are open and are following very seriously the guidelines that have been put forth. I know I don't shop all over the place. I've only been in Kahnawake myself. I haven't left since March 12th or whatever day that was. I've been in Kahnawake the whole time. And I see what the stores have done, and they have done a good job. So if you follow that role model, you'll do well. For those who are going to be coming in, remember we mentioned this on yesterday's program. You want to see one of these certificates of inspection. If you go into a store, it means that they've gone through all the processes that they need to. So with that, we'd like to say thank you so much for joining us today. We will be back tomorrow because tomorrow is a big day and it'll be interesting to see how it all turns out. Good luck, everyone. Remember, stay clean and stay apart. And of course, if you're not feeling well, stay home and get checked out. So on behalf of all of us here, take care. Yaw ko dano, onigiwahi.